So, Dr. Saloni, please let our audience know what are the types of acne and what are the age group in which acne usually occurs. Can it occur at a age group other than adolescence and teenage?
So acne is basically, an issue of the oil gland of the skin. Skin, of course, is, the largest organ in the body, and these oil glands are present all over the body. So any obstruction in the outlet of this oil gland can lead to something known as acne, right? So let me explain to you what are the different types. So when this oil duct gets blocked, there's accumulation of oil within the skin that can lead to something known as, closed and open comedones. The open comedones are very commonly known as blackheads, so that's basically the oxidation of the oil. That's why they appear black in color. When this oil accumulation gets infected, then you start getting these red eruptions and red bumps on the face. And this, of course, when there's so much accumulation, infection, the oil duct may also rupture, and spread its contents into the surrounding skin structure, which leads to a very, very severe form of acne, which is, nodulocystic acne. So grade one would just be these small, blackheads and whiteheads. Grade two is when, there's some infection, some amount of pustules come in. Grade three, of course, is when nodules come in, when the infection is of greater severity. And grade four is a very severe grade of acne where you can have nodules and boils and cysts all over the face, including, the chest and the back as well. So that would be the grades of acne, the severity. Now, the types of acne, as you very, rightly asked, can it affect any other age group apart from the adolescent age group? The answer is yes. So there is something known as infantile acne, which can occur during the first few months of life. This is under the influence of the maternal hormones, which pass on to the child. So it's basically a benign condition, can be treated, with a topical medicine. Sometimes it may go away on its own. Then, of course, is the adolescent age group, which is because of the physiological hormonal changes that take place. In some children or adolescents, it may be mild. In some, it may be moderate to severe. So that's where we step in and, sort of treat them, especially when it's moderate to severe, because that can lead to scarring. Then, of course, is adult acne. Acne which, presents during a later part of life, after adolescence, after say about, 25, 28 years of age. And this can be seen in women who suffer from hormonal issues like polycystic ovarian disease. And this can also be external in nature when a lot of, occlusive makeup is being used. Now, of course, the mask acne has come in. During the pandemic, a lot of mask was also being worn. So acne can present in, the adult range as well. So that is adult acne. And sometimes even in the elderly age group, you can see something known as senile comedones. That is basically because of wear and tear of skin, and again, the sebum and other dead cells may accumulate, and that may lead to these sort of large comedones in the elderly age group as well. So these would be the different, age groups that can be affected depending upon the site. Of course, we all know about acne on the face, but they can also be truncal acne, which is predominantly over the back, and can also affect the arms, sometimes the chest as well. So that would be the answer in a nutshell. I hope everybody's understood it well.